We're now joined by Gordon Denlinger. He's the Pennsylvania State Director of the National Federation of Independent Business. Gordon, thank you for joining me.
Thank you. Good to be with you.
Tell us a little bit about your organization. What types of businesses does it represent?
NFIB is a broad spectrum business advocacy association. We have about 13,000 members across the state of Pennsylvania and close to 300,000 nationally. And really every type of business can and should be a part of NFIB. But typically these would be your small, or what we would call mom and pop type businesses. So the corner deli and the card shop and the hardware store, all of the sort of Main Street businesses and smaller businesses that you interact with would be a part of the NFIB type of business and the type of business that we advocate for. So that's the membership nature of NFIB. And of course, this is a time of great challenge for small businesses across the state of Pennsylvania.
Earlier this month, Governor Tom Wolf ordered non-essential businesses or non-life sustaining businesses to close. What did you hear from your members after that?
Well, it was a lot of challenge in that declaration, and certainly no one would say a negative word regarding the governor's motives, and we do acknowledge the nature of the health crisis that we're all in. So that's, of course, first and foremost. But beyond the health aspects are the economic or business pieces of all of this as well. And folks were hit really suddenly with the closure order and really kind of thrown off balance, if you will. So a lot of businesses were scrambling to figure out, am I in life-sustaining or non-life-sustaining? It seems like half of my business might be part of one or the other. So a lot of difficulty, a lot of challenges, but folks genuinely trying to get to the right answer and trying to do the right thing. So that was there, but it was definitely a stretch of a lot of confusion at the beginning here.
Now, the governor does have a waiver process in place for just looking at that distinction between life-sustaining and non-life-sustaining. Are some of the businesses that you represent going through that process?
Well, there was a process in place until Friday, last Friday at 5 o'clock, when in fact the governor and the administration ended the waiver process. So yes, we were, as NFIB, strongly encouraging folks who thought, they might be in that life-sustaining category, but were not sure, to go through the filings with the DCED, Department of Community and Economic Development. And we do know that thousands of our members did file for waivers. Some received them, some received a no, some received it clearly, you're on the list here, so no question either way. But unfortunately, the governor closed that waiver process last week, as I mentioned, and this is really unfortunate because as this crisis is moving forward, there are adjustments and changes along the way that could cause the need for some businesses to ask the question, hey, could we now potentially look at opening businesses that are migrating toward production of PPEs or personal protective equipment, face masks, other things, when that had not previously been their line of business. So where are they? Where are they in that mix? And if they had assumed closure was what they had to do, where should they be now? So we really have called on the governor to reopen the waiver process. We think we need it back. We need a place for businesses to go to figure out, where do I stand? And is there some way I can help in this crisis situation and potentially put some people back to work carefully, following the guidelines of distancing, but put some people back to work and try to do some good. So we have called on the governor very publicly to reopen the waiver process. We hope that would be revisited.
How is your organization communicating with the state government? Are you able to communicate directly with the Department of Community and Economic Development or with the governor's office?
We do have points of contact. We would love to have more, but certainly we do advocate directly with the administration, and that's for folks, with cabinet secretaries, deputy secretaries, and with folks within the executive offices. So we do reach out where we can, but we have at points not been afraid to, I guess you'd say, take strong stands on behalf of small businesses when we felt there was inequity in the process. And again, not impugning anyone's motives here, but at points that has drawn us to criticizing the governor and trying to do it respectfully, but pointing out places where this could have been handled much, much better. And we do think in that open versus closed process, in the taking away of the waivers, which we really need that process put in place, there's some things that could have been done better in this situation to try to get us to a better answer for our small business owners, respecting, again, the need to be safe and to follow CDC guidance on distancing and on sanitation.
Now, the federal government has passed a $2 trillion measure to try to help many different aspects of our society during this period. Are there any programs in there that can benefit your members? Absolutely.
And the CARES Act, which is COVID-3, is certainly a lifeline. And right now, small business owners across the state are working to navigate the PPP or Paycheck Protection Program process, which is being pushed out through SBA, Small Business Administration, to banks, SBA lending banks and credit unions all across our area. And I have to give a shout out of thanks to folks in the financial sector for all they're doing to try to navigate what has been really challenging in terms of the level of guidance, the rapidity of information coming out of Treasury, the U.S. Department of Treasury. So our financial professionals are doing what they can. There is some of our members at NFIB are a little frustrated. That's understandable, but with anything this big that gets rolled out this quickly, there's going to be bumps in the road. The key is for our small business members and folks out there, just keep working with those financial professionals and get to the right answer. But yes, those programs from the federal level are a true lifeline, and we know that hundreds of thousands, millions of small businesses are applying, will be applying, and those funds are going to be what keeps the vast majority afloat during this crisis situation.
What types of programs are operating at the state level that are helping your members?
Well, we have seen a program put together through DCED, Department of Community and Economic Development, which was a loan program, but it frankly tapped out in a hurry. It really was accessed by a lot of small business owners. It was $61 million in size, and it went pretty quickly. I think at this point, most small business owners are looking to the federal government for the more significant point of relief. But we do appreciate our state elected officials, those folks, which is the governor and House and Senate, for attempting to put together a program. And certainly small business folks utilized it because it's fully used up at this point. I don't know if there will be more coming at the state level, but again, I think most of our small business owners are looking to the federal, to the CARES Act and the PPP program for their most significant point of relief. So appreciation for the state, but at this point, the funds are exhausted. And we do know that the state government is going to have major budget challenges of their own to deal with. So we'll see how that process works out. We're in budget season at this point, and how they're going to put together a budget, I do not know. But we do appreciate their efforts to try to stand with small business, both the loan fund and some other points of regulatory relief and tax relief as well. So many good things from our state elected folks.
Well, Gordon Denlinger is the Pennsylvania State Director of the National Federation of Independent Business. Thank you for speaking with me.
Good to be with you. Thank you very much.
PCN offers Pennsylvania organizations, business, and associations the opportunity to have their message telecast statewide. Fusion on PCN is a platform for you to reach out to all of Pennsylvania using our statewide cable network and online streaming. You produce the content with your message, and PCN delivers it statewide. Fusion is a partnership that helps expand your reach and meet objectives through an alliance with PCN. Go to pcntv.com/fusion for more information.
We're now joined by Angela Liddle. She is the president and CEO of the Pennsylvania Family Support Alliance. Angela, thank you for speaking with me.
Thank you.
Tell us a little bit about what your organization does.
Well, we're all about preventing child abuse and protecting children. So we provide statewide support and education programs for parents and caregivers of children, training programs for professionals and volunteers who work with kids in their careers on how to recognize and report child abuse. And then we help community members understand what they can do when they believe a child in their midst is not safe.
So what are some of your major concerns now with the coronavirus crisis?
Well, on a few different levels, really. Regardless of socioeconomic class, very few parents are used to being around their children 24 hours a day, 7 days a week. So you couple that with the stress of perhaps not having sufficient food, not being able to really cover the rent right now, or take care of some of the basic living needs because you've been unemployed, furloughed, whatever. You don't have childcare. It's really an incredibly stressful time for folks. So even the strongest parents can find themselves speaking a little more harshly. And then, of course, our ultimate concern is that children are not around mandated reporters right now. They're not going to school unless it's a really serious issue. They're not in front of medical professionals, school bus drivers, anything like that. So the likelihood of abuse and neglect increasing in our statistics after this time period ends is quite large. And so that's ultimately our concern for children's safety right now.
What types of services are you providing now that is different, say, from what you were doing before?
Yeah, well, like most businesses, everything for us kind of turned on a dime. So we train 25 to 30,000 mandated reporters in person every year. Obviously, people are not gathering now. So we're doing education and training virtually. In fact, tomorrow we're training 600 mandated reporters. So we're doing that now using technology. We're working a lot with the agencies throughout Pennsylvania to provide ready, at their fingertips, resources to use with parents, grandparents, and caregivers. So many community-based agencies are keeping in touch with parents on the phone, maybe through FaceTime or through Zoom. And so we're providing resources for them. And the things we're giving them are things that would help parents know how to talk to kids about this time, how to have practical tips of maybe not exposing them so much to the media, talking to them at age-appropriate levels regarding our circumstances right now, giving them really inexpensive ideas that they can do in terms of activities and entertainment while they're all home as a family, things like that.
So if families want to participate in this type of training, what would they need to do?
Well, we would encourage families to reach out to the agencies in their community, their local family center, any agency that would provide usually parenting education support services. They're found in every single county in Pennsylvania. We provide the support services onto those staff to then use with parents. But for mandated reporters to receive training, we would just ask that they be in touch with our agency at www.pa-fsa.org.
So how would you assess how local and state agencies are handling the situation?
Well, from our perspective, we give a very high rating to Governor Wolf and Dr. Levine. I think they've been giving very, very clear, good, practical suggestions and being very cautious about the safety and well-being of all Pennsylvanians during this time. I think in terms of other groups, we've seen folks pull together and do really wonderful things. You know, think about some of our corporate sponsors and partners. All of our April events were canceled, and yet they understand that this is a critical time for us with a loss of funding. So they're, still supporting an organization like ours. I think about groups like UPMC, where they're pulling together their resources to do a coronavirus toolkit for families and folks in the community. Things like that are incredibly important. So no one entity has all the answers. No one entity has all the resources. But if we all bring to the table what we have, hopefully it's enough to get us through in pretty good shape as a community at large.
Now, if there are children who want to get in touch with the organization or take advantage of some of these resources, how do they directly contact your organization?
Well, we provide services really to adults only. We would encourage, if there are children who are feeling not safe, we would hope that they would somehow be able to reach out to a trusted adult, perhaps through social media or something like that. We're really encouraging family members too, grandparents, aunts, uncles, even neighbors, really, to touch base with folks in your circle. Maintain contact as much as you can with grandchildren around FaceTime or things like that. So you're laying eyes on folks, you're seeing how they're doing, you're offering your own couple words of encouragement, making sure that they have what they need to get through this day and maybe the one to follow. So around things like basic necessities, food, those types of things.
So you mentioned your relationship with some of the local child services agencies. What are you hearing from them about their concerns?
I think we all have the same concerns. I think they're very similar. We know that reports right now of child abuse and neglect are low because the bulk of them are made by mandated reporters. So we're bracing for whenever this time passes, which, let's be honest, none of us know when that is. We're expecting to see an increased number of reports. And then, there are things that the child welfare system will have to, respond to and investigate. Right now, all 67 county child welfare offices are open. They are following up on investigations if reports are made. So very much the system at large has the safety and well-being of Pennsylvania's children as the top priority. That has not changed during this virus time. The state's hotline for reporting child abuse, which is Childline, and we should give your viewing audience that number. It's 1-800-932-0313. They're receiving calls. So by and large, everyone has just had to figure out a different way to do the very core essential priorities. And I think that's what we're all doing.
How do you keep track of trends in this kind of a situation in terms of whether you're seeing more incidences or fewer or more, or do you just do it by number of people who are calling?
Yeah, we're really paying attention to data right now. So, for example, our training transitioning from face-to-face to virtual, those numbers have astonished us. The Wolf administration has put a relaxing on the renewal of licenses and certifications for healthcare-related professions under the Department of State. So that means people don't need to do their continuing education right now. Nurses, doctors, dentists, those folks. And yet we see a lot of people reaching out and taking the training that they would have done face-to-face virtually. So we pay attention to data. I'm sure the State Department of Human Services will do the same in terms of the calls coming into Childline, as will each of the 67 county child welfare agencies. They'll be looking at, what were we seeing during this time? And I guess, what we'll all hope is that we don't need to ever really use that data for a next time. We hope this is a once in many generations that we experience something like this.
Now, going forward, are there any policy measures that you would like to see implemented that can help this current situation?
I really don't have any suggestions at this point. I think, for any of us, it's really not even time yet to do any of that Monday morning quarterbacking. I think everyone is, doing their level best right now. I think people are having their basic needs addressed. And it's about really joining with our partners like you in the media to make sure that we get messages out to parents and caregivers. It's stressful. So please, by all means, if you're 24 hours a day with a child or several children, do not in any way be embarrassed about asking for help. If need be, you call a local agency in your community, you reach out by phone or by text to a neighbor, anyone, for some additional support and assistance, because it's very, very difficult, you know, and we want to say the same thing to neighbors. Now really is the time to be a very, very good neighbor in whatever way you can. So for instance, there are no young children in my home right now, yet there are neighborhood children. And so we make sure there are things dropped by the porch for parents to do activities with their kids. You would be surprised what a small gesture like that will do in the life of a parent and children in days that can be rather long when you're not going out to school or work or you know, daycare.
Well, Angela Liddle, President and CEO of the Pennsylvania Family Support Alliance, thank you for speaking with me.
You're welcome. Thank you.
After a great victory over Union forces in June 1863, Robert E. Lee marches his army to Pennsylvania. The advancing Confederates clash with General Meade's Union Army at Gettysburg, beginning the most famous battle of the Civil War. Explore our nation's past and the Gettysburg battlefield with the Gettysburg Collection. Become a member to stream the library online. Learn more at gettysburgcollection.com.
I'm now joined by Dr. Adele Caruso. She's the president of the PA Coalition of Nurse Practitioners. Dr. Caruso, thank you for joining me.
You're welcome. Thank you for having me today.
Can you talk a little bit about what a nurse practitioner is?
Okay, so firstly, I'd like to say that nurse practitioners are nurses with advanced training and education, and with that advanced training and education, we are able to care for patients as a different type of healthcare provider. Some of the things that we do are ordering and performing and interpreting diagnostic tests, diagnosing and treating acute and chronic conditions such as diabetes, high blood pressure, infections, injuries, prescribe medications and other treatment, and manage patients' care. Nurse practitioners hold advanced degrees like master's and doctorate degrees, and we perform a lot of the same services as physicians. But again, we're a different type of provider. We practice advanced practice nursing.
Now, where are patients most likely to encounter nurse practitioners?
So, good question. So, nurse practitioners are practicing in many areas in healthcare. So you can meet a nurse practitioner in the primary care setting. You can meet nurse practitioners in a hospital setting, in many areas of practice. Women's health, psychiatric, and mental health care services, pediatrics, different specialty areas like medical oncology, urology. So nurse practitioners are practicing in, across, the healthcare system in most areas that you would find other, healthcare providers like physicians.
How are they licensed in Pennsylvania?
So in Pennsylvania, nurse practitioners hold a license as a registered nurse, and then we are certified as nurse practitioners on our nursing license. We also have the ability to prescribe and have a license for prescribing, and a license if we choose to prescribe controlled substances.
Now, how is the coronavirus crisis impacting nurse practitioners?
So, in regard to the coronavirus, first, and the COVID-19 pandemic, first I really wanted to thank, all the healthcare providers and first responders who are on the front lines in Pennsylvania. Without them, I think we would see a different outcome. and whether the healthcare provider is a physician, nurse practitioner, and there's many other healthcare providers. Everyone is really putting their lives on the line to protect citizens in Pennsylvania and to care for them. In regard to your question, so how is it affecting nurse practitioners? Nurse practitioners are providers who want to serve our patients, and currently, we thank the governor, Dr. Levin, and the Board of Nursing to recognize that nurse practitioners are important, in the pandemic as far as caring for patients. And what the governor and Dr. Levin and the Board of Nursing have done, they have helped relax the statutes and regulations to allow more flexibility and waivers of regulations so that nurse practitioners can do their job and where they're needed in the crisis. So nurse practitioners are ready to serve and care for patients in this crisis, and we're doing that with the help of the governor, Dr. Levin, and the Board of Nursing, helping us work through different issues that can prevent providers from practicing. So they have really helped with that. And we especially, thank the Board of Nursing because they've worked directly with the Pennsylvania Coalition of Nurse Practitioners to help members with nurse practitioner licensing with the prescriptive authority changes that they help implement, allowing retired nurses to come back and practice, and that many other efforts of the Board of Nursing is doing to help with relaxing, some of the barriers that exist, in this crisis.
Can you talk a little bit about those barriers? I mean, can nurse practitioners go anywhere and work, or what types of limitations are you talking about?
So some of the limitations that the Board of Nursing has worked on are, waivers that would allow nurse practitioners to practice in a different location or out of their population focus area so that they could help patients in need. And for instance, if a nurse practitioner was working in one area, she would be able to go to a different location in the hospital to work in order to care for patients, especially, if that area, was less busy because, for instance, if elective procedures were being delayed because this is a time of crisis, then nurse practitioners would be reassigned or deployed in a different area of the hospital. So some of the type of things that we're looking at are the location changes, which is helpful, but also different waivers that help with the ability for nurse practitioners to have just one collaborative physician where currently they may require two, or if there was someone that needed a collaborative physician, they would work towards helping that nurse practitioner find one, although that may not happen at such a pace that's quite needed in the pandemic.
You mentioned these collaborative physicians. There's the phrase collaborative agreement. Are nurse practitioners required to only work with specific people that they have an agreement with, or can they just work generally anywhere?
So currently, a nurse practitioner is trained as a advanced practice nurse and professional, and in order to practice, we actually need a signed business agreement with a physician and a backup physician. So one of the things that we require in order to practice is to have a collaborative agreement in order to practice and in order to prescribe.
What is involved in getting a collaborative agreement?
So if you're in a private practice, you would need a collaborative physician who's working in that practice setting with you. If you are working in perhaps like in a hospital outpatient setting, you could arrange to have a collaborative physician who works in your practice and a backup physician. And in that case, that could be someone that's in your practice, and you would need to have that arranged up front before you can work.
What are other states doing to assist nurse practitioners to move out beyond some of these limitations?
So across the country, there's a national trend to remove the barriers to practice with this mandated agreement. And the reason for that is to, allow more immediate access to care because there are many areas that nurse practitioners could potentially work, but there may not be enough physicians available to have a collaborative agreement with. So more, about 22 states plus the District of Columbia, have laws that do not require, nurse practitioners to have this agreement, and that's called full practice. And even in the COVID crisis, there have been several states that have allowed nurse practitioners to have that agreement waived during the crisis, which has been very helpful to treat patients and to allow more immediate access to care during the crisis, especially to increase the numbers of nurse practitioners that are available to see patients.
We'll talk a little bit more about full practice authority. How would that expand nurse practitioners' capabilities versus what it is today?
Okay, so right now, if nurse practitioners would have full practice authority, they would be able to, care for patients in areas where there are physician shortages. And we know that over the past many years, as long as I've been in practice as a nurse practitioner, there has been a physician shortage, and there have been nurse practitioners and a growing number of nurse practitioners that have been working in Pennsylvania. There are now 13,700 nurse practitioners. And those nurse practitioners have actually been caring for patients across the state in all areas. And in those areas that there's been a physician shortage, we have seen that we have a growing number of nurse practitioners. It would be easier, for instance, if there was a county or so that only had one or two physicians, and maybe one of those physicians is going to retire. If nurse practitioners were allowed to practice in that area, potentially you could have the number of providers increase by 4 or 5. But of course, if there aren't enough physicians to have collaborative agreements with, that would limit, nurse practitioners from practicing in those areas. And then of course it would limit, patients' access to care.
Now, there are 2 bills in the General Assembly that are addressing nurse practitioner issues, House Bill 100 and Senate Bill 25. What would those bills do?
So right now, the 2 bills, yes, House Bill 100 and Senate Bill 25, what they would do is they would remove the practice barrier, which is the collaborative agreement. It would allow nurse practitioners to practice to their full extent of education and training. Many, states across the country have had success with this and have shown that nurse practitioners have practiced in those areas that access to care is increased, and there's lots of national data, to support nurse practitioner practice and their outcomes. So I believe that, with all of that national data, and Pennsylvania certainly could benefit, from having more nurse practitioners in every area. So when I talk about, different counties in Pennsylvania. I mean, it's almost every single county where there are not as many physician providers as we would like. And there is a growing number of nurse practitioners. So, patients have had great experiences with nurse practitioners. Most people in Pennsylvania have had exposure to a nurse practitioner. Patients in Pennsylvania, many see nurse practitioners as their primary care providers. They're qualified and, ready to care for patients. We just need to be able to do that more readily. In this situation with the COVID-19 pandemic, we would not have had to do a lot of the work that the Board of Nursing has been doing to, go through all these waivers. If we had full practice, they would not have needed to be working so hard and relaxing the restrictions, et cetera, because we just wouldn't have that. It wouldn't be an issue.
Well, we're out of time. Dr. Adele Caruso, President of the PA Coalition of Nurse Practitioners, thank you for speaking with me.
Oh, you're welcome. Thank you.
Take a nostalgic look back at some of the best games PCN has televised over the past 20 years with PCN Sports Classics. Watch the entire game without interruption and get updates on key players and coaches who have made Pennsylvania sports history. Watch new episodes monthly and stream the full series on demand with the PCN Select streaming service. Visit PCNTV.com to subscribe. PCN, proud to bring Pennsylvania sports to you.
State Senator Kim Ward is a Republican representing Westmoreland County. State Senator, thank you for joining me.
Thank you very much for giving me the opportunity to speak with you and the public.
Tell us a little bit about your district and how coronavirus is impacting your district.
So we're not overwhelmed here in Westmoreland County. I think today said 77 cases, 75 cases. I've been on conference calls all morning, so I did look at the numbers. But it doesn't look like we are doubling or we're getting 10 more a day or 9 more a day. That's what we're getting. And we are a county of 350,000 people. We have plenty of ventilators and plenty of hospital space right now available if we need it. And, when you look at it statewide, that's the case statewide. We have 51% of our hospital rooms available and 70% of our ventilators, according to Secretary Levine in her latest news conference.
Now, the Senate changed some of its rules to allow remote operations. How is that working out?
Okay, so today we had session and we voted on some bills, and it was very smooth. Last week was our first stab at it, the week before, and it was a little shaky trying to get everybody up to speed on how to do it. Our biggest challenge while we're in session is to remember that they can hear us, and that we shouldn't be doing anything like be on our phones answering messages, because they can also see us. So the biggest challenge is just remembering that you are sitting on the Senate floor and not in your office or your dining room.
Now, what are some of the key pieces of legislation that the Senate has passed during this time period?
I think that we did some really good things today with the online notaries being able to remotely notarize things, because our car dealerships have been closed down. They haven't been able to sell vehicles and it was one of the sticking points. We're giving local municipalities and local governments the ability to meet online, just like we're talking now, remotely, instead of having to be there in person, so that they can carry on the business of the townships, giving them the ability to delay their tax deadlines. So we have been doing things like that some of that stuff just seems common sense anyway. And maybe it's a new world out there. Maybe it is. Maybe that's the way a lot of us continue to do government at times. Sure save the state a lot of money if this is how the legislature met, that's for sure. No per diems, no hotels, no travel. So it's trying to do things to help, and especially to help our business community, because we're struggling. We have really high unemployment, really high. I was well over 1 million claims. Is a challenge with the narrative out there with the president and the CDC and our Department of Health. This is supposed to be a really bad week. this week and next week are just supposed to be the worst weeks. Thank God so far it's only Tuesday, but in Pennsylvania, it doesn't look like it's heading that way. So we should keep our fingers crossed. They have been saying, oh, we are a couple weeks behind New York. Well, if we are, it doesn't look like it, because New York's been a disaster for more than 2 weeks, that's for sure.
Now, you're sponsoring a bill that would offer some protections for first responders. What would your bill do?
It would give the Department of Health the ability, it would tell them that they should give municipalities and the number of cases in these municipalities to county commissioners or the county executive or their set 911 point person, their coordinator. So the counties that have departments of health can already do this. And in fact, some of them are actually giving the addresses. So if you get a call into 911, they're going to tell the first responder, we are COVID active. But this bill would cover more than just COVID. It would cover anything like any pandemic, because we can't have to do this every single time there's an issue comes up. Not that they come up that often. And this bill that the Department of Health is citing is a 1955 bill. So it needs to be updated. We're trying to work it out with them. The bill that I'm sponsoring does not give a name. It does not violate HIPAA in any way. It just lets first responders know where their precious resources should go. So if we had a perfect world and we had just tons and tons of private protective equipment, this wouldn't be a big deal, because there would be enough to send everywhere. And every time a first responder would go out to a call, they could just dress accordingly, protect themselves with all this equipment we have, and we wouldn't have to worry about it. But the fact of the matter is, we haven't had an overabundance of personal protective equipment. So where do you send it? Do you want to send it out in mass to make sure every first responder is covered, even in areas where there is maybe no cases? Or do you want to make sure that the area that has 50 cases has everything they need? It is, to me, not only just protecting these first responders, but it is using and targeting our resources, where our limited resources, where they need to be, where they need to go.
Now, the governor has ordered the closure of non-life sustaining businesses. How is that impacting business in your district?
Oh, it's very much so. I've talked to some businesses, and they can maybe go another week or two. But these small businesses, many of them are going to have to close shop. And when I look at, Walmart, they're opened. When you think about it, we're sending everyone. So maybe your area doesn't have a lot of COVID cases, but we are sending you all into a big building full of people with no monitoring of your social distancing, where instead of going to, say, your local shop that maybe gets 20 people a day in there, it's I know the governor, this is a first for all of us, and they're doing the best they can, but this is really hurting businesses. I would much rather go to a small shop than go to Walmart, because I have less chance of being infected. I'm hoping we get to the point, after we get through what's supposed to be this really bad week, we get to the point where we can open the businesses, they can follow coronavirus protocol, and get back to work and stay safe. That is a big goal, and it's important. Our economy is just being smashed. When you have over 1 million people filing for unemployment in Pennsylvania before we even have the paperwork we need from the Fed so that independent contractors can file, that says everything. And this waiver process has been a disaster. I'm glad that they stopped it. And I know they were doing the best they could. But when you have numerous people looking at waivers, you're going to have different opinions. So I was always getting, well, this car dealership's open, but this one can't be opened. This shop can be open, but this shop can't be open. It was very hard. It was very hard for these businesses to accept that things were just being done, and not on purpose. That wasn't being done on purpose in this inequality. was being done because they had to put it together fast and they had a lot of eyes. So it was very, very subjective on these applications.
Now, you joined with a group of other senators to sign a letter to the governor relating to opening businesses. What were you specifically asking him, and what kind of response did you get?
Well, I don't know that we've received a response yet, but I would very much like to see these businesses be able to open using the coronavirus protocol. We can wear a mask, we can keep social distancing. Some of these businesses could do it by appointment. But I just think that they were in a hurry and they blanket closed a lot of things, and many times they were not thinking at all of the supply chain in their zest to get something done and protect Pennsylvanians. It wasn't always perfect.
Now, you're the chair of the Senate Transportation Committee. What types of transportation-related issues are you dealing with in this crisis?
Well, we started with the rest stops being closed, trying to get them back up opened, and to get the highway construction back up. We were the only state in the nation to close down highway construction. Some states were doubling up because there was nobody on the road. So in Florida, they were working at night. They were trying to get their construction projects done at night because there's nobody out. It's a perfect time. So, we've been working with a lot of the constructors and the transportation interests, and we work with PennDOT, and they've now opened 160 projects across Pennsylvania. Last week they decided it would be okay. I mean, all these businesses all had to have a coronavirus protocol in place, and we're hoping to get more up as more and more of these projects can be coronavirus ready. Whoever thought would be saying that. Hopefully we can get more of these projects up, because it does matter with our unemployment. It matters a lot. These people are out of work. One of the hardest things has been listening to people, and my social media is very active and it's open to anybody, and to listen to them having such a hardship right now. It's been 3 weeks since I've had a paycheck. I can't get through the unemployment department. I'm not getting an answer because they're swamped. There is no state in the country that was really prepared for the onslaught of applicants that they are experiencing right now. Nobody was ready for this. So they're doing the best they can, but it's difficult telling folks, hold on, hang in there. You just feel for them. You just feel terrible.
Well, Senator Kim Ward, a Republican representing Westmoreland County, thank you for speaking with me.
Well, thank you for having me.